us take a brief tour of the brain in an individual with a concussion. Let us start with the frontal lobe. Patients with concussions often have damage to the frontal lobe that causes difficulties with judgment, irritability, and difficulty multitasking. For example, I've had patients who've come in and said, I went to Walmart and spent $4,000 in one shopping visit. Or, I logged on to Expedia, I don't know what I was doing, but I ended up booking a trip for several $1,000s and I didn't mean to. You often see these findings with individuals with concussions. As we move to the temporal lobe, the temporal lobe is responsible for speech, and therefore, in cases of concussion, you'll find individuals that have difficulty finding words, stuttering, also more emotional. In some cases, patients will report that I'll be watching a movie and out of nowhere, I'll just start crying and crying. And I never used to be emotional with TV shows before. As we move on to the parietal lobe, in some cases responsible for calculations. I've had many high school students whose mathematical ability has moved down several grades following a concussion, and they have difficulty processing numbers. Also, the parietal lobe is responsible for directions. We will have patients who will say, your office is right in my neighborhood. I've driven by it many times, but I couldn't find my way here today. It's common in some cases of concussion. As we move to the occipital lobe, responsible for vision. We've had instances where one particular patient who looked on her driveway and noticed that her boat was no longer there, reported it stolen, and when they came to investigate, the boat was sitting right there. Now that's an extreme example, but different things happen to vision with concussions as well. The cerebellum, balance. Very often you'll see concussion patients that have impaired balance. Even high-level athletes that have excellent balance, following a concussion, can have much impaired balance. It's also one of the reasons why so many concussions happen shortly after the first concussion. As we move to the brainstem, it's responsible for nausea, dizziness, and other symptoms. And there's several individual cranial nerves surrounding the brain that can also be injured at the time of a concussion. For example, the olfactory nerve, which is at the base of the brain, responsible for the sense of smell, will often have patients following a concussion come in and say, I can't smell anything. In some cases that improves, and in some cases that persists. That's a brief tour around the brain of an individual with a concussion, and it's important to note that a concussion can affect the entire brain.